The huge issue because they're not known and you don't study this in university. So this is something that comes afterwards if you're interested in it. Cavitations is the layman's term for something called, better called FDOJ, which is a abbreviation for fatty degenerative osteonecrotic jaw bone. And this is basically what it is: mushy necrotic bone. How does this even happen? Whenever we pull a tooth and your body's not able to heal it, this happens. It's just a sign of poor recovery and hibernation mode, is what I always say, and too much of a traumatic surgery, maybe, that causes this in the first place. Which teeth are pulled the most in the Western world? It's the wisdom teeth. Why? Because we grow too narrow. Why? Because our nutrition is wrong. It starts with breastfeeding, it starts in the womb. So Weston Price showed it 100 years ago. So this is why most of my patients have cavitations. Most of your patients will have cavitations from their wisdom tooth removal. It can happen after any sort of tooth removal, but wisdom teeth is also very prominent in teenagers. And then they end up being chronically fatigued afterwards, or have an autoimmune disease, or irritable bowel syndrome, or skin rashes, or being depressed, or all of it. And nobody knows about it because you don't see it on a conventional x-ray if you're not trained to. This is why you need a three-dimensional cone beam, and you actually need to know that it's existing, because if you send a cone beam to any sort of maxillofacial surgeon or any dentist to diagnose it, and they don't know about that phenomenon, which is called FDOJ or cavitation, they won't diagnose it because it's not in their curriculum. They don't even know about it. So if you don't know about it, you cannot diagnose it. And this is something that is really missing in university. My good friend and the Yoda of cavitations, Dr. Lechner, did studies or research for the last 42 years. He's already 72 years old, and this is his life's work. I think he has 15 peer-reviewed papers already. But you can also find it out because in these cavitations, let's say these mushy degenerative jaw bones, which are maybe at your wisdom tooth area, there is a specific, it's not a chemo, it's not a cytokine, it's a chemokine, which is called RANTS, RANTES, or you can find it medically with CCL5, chemokine lignin 5. If you Google Scholar CCL5 or RANTES plus multiple sclerosis, for example, or any other disease, you will find 3,000 references straight away. That means whole medical world is searching for where is this RANTES coming from, but they don't know it's from the mouth because the dentists don't even know. You understand? Right. It's really bad. And there's good studies showing, for example, through this ongoing inflammation in the jawbone from these cavitations, they found this RANTES hyperexpression also being connected to breast cancer. Crazy. It could be connected to always anything: trigeminal neuralgia, migraines, all these things that are connected to your brainstem, brain fog. It's just always a lot of times these things, and the problem is nobody knows about it. And you could open up a miracle healing clinic and only do these surgeries, and people will tell you it's insane. Wow. I had the surgery. My nervousness was gone afterwards. My skin rashes were gone afterwards. My chronic back pain was gone. And I didn't even know that I had that. It was just by chance that we did a cone beam and found it. I was grinding at night like crazy and super stressed. It was just my body trying to compensate for that huge chronic inflammation surrounding my trigeminal nerve, which also probably contained heavy metals, glyphosates, and lots of chronic infections. Like mold. Mold lives in there for a lot of people. That's why a lot of American people come fly in, because they have a huge mold issue, and mold spores tend to live in there.
Wow.
And because of the heavy metal content, it's really, really nasty if you see that.